Jillian. It's a pleasure to be a part of this webinar, and I'm hoping that I can shed some light on some of the work that I've been doing with the platform and, kind of bring things in a different perspective. So, the goal today is to talk about efficiency using a virtual platform or building in virtual check, I call it, in a clinical practice, day-to-day operation. So, a little bit background about what I do, just to kind of put me in the perspective of like the things that I'm going to explain to you today. So, I teach at this school at the University of Washington part time, and my practice is almost 5 years of startup, two location in Sammamish and Bellevue. And just for the sake of putting again things in perspective, I am between Microsoft campus. Like my two practices are like each side of Microsoft. So almost 80% of my patients are techie people. So this is exactly, resonate with most of them. So there are things that I'm going to explain that you got to think about what kind of population I'm working with. I have two study clubs. One of them is specifically for orthodontists, and I'm a clinical advisor for a few companies, including Grin. So full disclosure, I want to be very, transparent about my financial interest. So let's look at, what are we going to talk about today? What I would do initially, I'll go over how I got involved with virtual orthodontic care, and I'll show you one of the study that was done at the University of Washington. And then we'll talk about how dentistry and, specifically orthodontics is transitioning, trending toward digital and combining digital technology to it, and how Grin fit into that equation. Then I'm going to talk to you about how I use Grin platform in the day-to-day operation and maybe some suggestion over there. And then I'll talk about how you're going to manage these digital tasks in a clinic, and specifically I'll talk about Grin. And then at the end, I'll try to kind of wrap up everything. So then kind of bring, to the conclusion and provoke a few ideas that you could think about it when you think about virtual care. So, back in 2019, when we published this study, and remember, it takes about 3 years to generate any kind of research at the school, at least with the resident. This was a paper that we published in 2019, and the study started around 2016, right? So what we did, we used data monitoring, which was, the only platform at the time. And the idea was, can we replace the So we started with 42 patients, kind of like, show them the idea, presented, and look at it. 8 of them, they said that they don't want to do it. 4 of them were not eligible because their cell phone was not compatible or other reasons. And then 30 finally enrolled. And then we started doing the study, and then we got to the point that 7 withdraw, 3 were like really poor in, doing the task, and then 20 final, finished the study, right? And it's interesting when you go and look at the data that we presented and the study. And at the time, I was really excited about this data because there was nothing out there. And when you look at this, the final outcome that we got from this study, can we replace a virtual check with an in-office visit? And it was an option. And we found out that about, fewer than half of these people were actually excited about that, and 18% were kind of indifferent about it. Then we have some people that they didn't want to do it at all, right? So, so this is a quote from a mother that was just like mentioning that was not interested in doing it. So what I like to bring to your attention in here is that there is no question that virtual check or virtual interaction with the patient is not going to be a part of our day-to-day life, but you got to figure out who is the right candidate for it. So, what do I do in my day-to-day practice? Showing you that the research I've done to it. We have 3 modalities that, we use it. We use the good old-fashioned MMS that, you get patients that they submit this kind of photos. It's a source of amusement. Sometimes you get these photos that are all over the place and you see the whole house except the teeth of the patient. And then we use Grin for different appliances that we use. I'll explain to you. We do use the trend. And so this is how I use it. I use basically 3 different platforms. And I'm going to talk to you a little bit about the paradigm shift in our profession and what is happening to orthodontics. I think this is something that is going to come, either I like it or you don't like it, right? So when you look at the digital orthodontics, the 2 major differences in in combining digital technology to the day-to-day practice of orthodontics. One is that you reactively not monitor the treatment, you proactively plan what are you going to do. So you basically, treat and plan the patient and then use these custom appliances, either aligner, fixed appliances, and render the care. So a lot of the work is going to be done up in front, and then you kind of monitor the progress and you look at how things are going to get to the end. The indirect bonding, you can see here, this is an example of DIBS with a KLON platform. It's a really powerful platform. I love it because you do the setup and you bond the brackets and you kind of watch them unravel. And then you have another example of a sure smile lingual wire on the right side that we do, again, indirect bonding, but is more conventional. Or you have Brius that, well, I'll talk about it, later. So when you implement this digital orthodontics into the day-to-day practice, then it makes sense to have some sort of a virtual platform to watch these plans that you have unravel, right? I mean, Align introduced this whole concept 20 years ago, right? And things are changing and revolving and more getting into there. So Aligner is not the only appliance that these days can be used for these virtual check, right? So you have a slew of all these different options that you can use that. And again, the beauty of this is everything is proactive. So you plan it, you watch it unfold, right? So that's why the importance of having a platform that can help you to watch these treatment unravel, is very, very important. You can see examples again, Bria system, Porth aligner, which is the aligner that we make in office in here, Sure Smile buckle, Sure Smile lingual, we have U Smile from ULab, KLON bracket, all the different, the good thing is that in our field, there's so many of these platforms are coming out. Lightforce is another example. So you could use all these fixed appliances with Grin to try to basically render the care to your patient. So when you look at how you're going to incorporate teleorthodontics into your day-to-day life, right? There are three phases of the, kind of orthodontic care in our day-to-day practice. You have the pre-treatment phase, you have the treatment course, and then post-treatment. And if you look at where you can fit Grin or virtual, consultation or virtual check into these three phases that you have, or three different bucket that you have in your care that you're providing, you can do the screening of for orthodontic care. You can look at dental development and observation, maybe even skeletal a little bit. And then for treatment course, generally the appliances that are designed, for digital work is a little bit better compared to appliances like things that are not digitally planned. You could still use conventional fixed appliances, but it's probably a little bit less than the one that are already customized. And then you could also look at the post treatment. You can do a phase 1 to phase 2. You can do retainer check. That's another phase that you can look at. So if you look at all these, group of, treatment that you can use combined with Grin or any sort of a virtual check, you have the reactive, orthodontic treatment, which, conventional functional appliances, expanders, or even fixed appliances that you basically bond the appliances on the patient, just do either the expansion or let them work, and then you monitor them virtually, not in their clinic, but through the platform that Grin is an example of it. And then you have the proactive, which I talk about a little bit. These are generally custom appliances, and I think on this topic, what I personally believe is that clear aligners is going to change too. I believe that the aligner therapy, which was developed 20 years ago, is going to change. Aligners are going to be an on-demand appliances in the clinic that you can use it through any course of the treatment. Aligners are not super efficient in certain movements, so you can combine them with fixed appliances, and that's where the hybrid appliances come in place. And for example, if I bond the motion appliances on the patient, I don't need to see them in the clinic. You could put them on Grin and scan them regularly, and then when I get to the point that I want it to be, then I bring the patient back in and do the next step in the treatment that I have. Or custom, lingual wire or buccal wire. So let's break these appliances down and look at what do we have in the literature, which is very, very limited, unfortunately, or easier for me to present stuff. But I hope that we get more papers published on these ideas. So let's start with aligner first, and then we'll look at the other appliances. So when you look at the aligners, there's actually one study that I found that is kind of complete. There's nothing else. There's a lot of opinion papers, a lot of case report, but nothing done to this extent. So I was actually excited to see this paper coming out. So what they did in this paper, which was fairly recently published, they look at 90 cases, 45 patients with dental monitoring, 40 with non-virtual monitoring, right? And the treatment modality was Invisalign for them. So they used the Invisalign appliances, and they had patients that they were seen in 6 to 8 weeks intervals, and then 16 weeks intervals. And then in each group they had 45. And then the weekly change was the protocol of choice for them. So when you look at, what was the, kind of like the distribution of the patients in this sample that they did this study, all the patients were adult, age range of about 30 to 31, which is very interesting, but you got to think about that when you try to kind of make sense of the result of these studies. About two-thirds of these patients were actually class 1. So relatively moderate, simple cases, right, that they were selected for the study. And then when you look at, the other data that they presented, the irregularity index, Bob Little index, so they look at it and there's a little bit more if you see in the control compared to the group that they had the remote monitoring. Maybe there was no intentional, and you can see it in here, both in the maxilla and mandible, a little bit higher compared to the other one, right? So just think about it. And then when you look at the data that they actually presented, you can see the treatment time for these patients were almost equal. There was 1.8 month differences, but when you build in the standard deviation, you don't see a major differences because the standard deviation is huge. And their statistical analysis also suggested that. So, having a virtual check, not having a virtual check in a mild to moderate cases of adult patients, not a major differences, right? That's very interesting to have, within the limitation of the study that you have. And then you can see that the amount of refinement was almost the same as well, which was 1.5, for both groups that they have. But they also showed that there's less appointment for the group that they were virtually monitored compared to the one that they were not virtually monitored. The caveat in here is that, these treatment was a little bit over a year, right? And if I look at my practice, try to reflect this study, my day-to-day life, I look at it and I was like, okay, so why did you see these patients for 11 appointments in a course of, let's say, a 14 months treatment, right? It doesn't make a lot of sense to me, right? So, in my practice, if somebody is like 14 months of treatment, I probably see them like six times. Like either I virtually monitor them, I don't virtually monitor them. So there's a little bit of maybe the setting is different, maybe this practice was different. And all of these cases, we came from one practice. So you got to be careful about, what actually generated this data and can we get some information out of this data? And then the other part that I could not find any information about it was that the fact that they actually, with the group that they did virtual check or virtual monitoring, they did the refinement earlier. So then the question that it raised in here is that, was that because they picked the poor biomechanics faster, or was it the compliance of the patient that was identified faster and they get their course back in together and then move forward? So it's very important to look at these data and analyze them correctly to see, can we get any conclusion out of it, right? So I think that's the only study that is out there. I really like it. There are some limitation with it, but I hope that I see more of these things coming out. There's another thing that, I think is kind of expanding in orthodontic world is this concept of appointment on demand. And I have a feeling that it is a function of the, pandemic that we went through it and check everything. And now this is what we have. And there are a few things that I feel like in this concept. So appointment by demand is like, I'm going to give you the aligners that you have, and then you just go home and you follow this, and I check you every week and give you some feedback, either, through automatic feedback or manual feedback. And whenever we have problem, you come back to the clinic and I'll see you, right? Conceptually, it's a very smart idea, right? But there are a few assumptions in that. First is that the scanning and communication with the patient is going to be smooth. And I mean, working with all these different platforms for these years that I've been looking at it, I can tell you that it's not never going to be smooth, no matter what kind of platform that you have, no matter what kind of system you're using. So you got to build that in. So it's like the idea that you're not going to bring the patient in here to the clinic and save appointment visit, and you're going to increase your value per appointment, which is the big premises and the incentive behind this concept, is not when the rubber hit the roads, there's challenging, right? The other thing is that the aligner is going to track well. I mean, I just showed you a study that they did this study, and they actually did the refinement even earlier than what you would think, right? So aligner tracking is always a battle, right? The other thing is that you would think that patients are going to be favorable in virtual visit, right? So, when you look at all the studies and the things that you see out there with virtual check, it's not for everybody. So if I switch my clinic to appointment on demand, like completely like on that, I'm going to lose some patients that are not interested in this model. So, you got to think about it. I think conceptually, this is a very good idea. I don't know how practical it is. And these are the questions that I have about this kind of approach. And I'm hoping that at some point we can answer these. So the biggest question is that, is shorter period of time is a function of more compliance with the patient, or we detect the problem that we have? And this is specifically for aligners. Is the quality of the treatment that we're rendering using these appointment on demand is going to be the same as an in-person or a hybrid where you bring the patient a little bit, let them do a virtual check of you, and then you want to see if the patient is actually experiencing the same. And I'll bring that back again later at the end of my presentation, because I think the patient experience in the crowded market that we live in is extremely important. And then the biggest philosophical big question is that, are we going to embrace the virtual life? I think people have been going back a little bit. This whole, the new normal is going to be somewhere between virtual and in person. So how do I use the clear aligners in my clinic? We use the 4-week cycle for the patients. If they are interested to do weekly, we can suggest them to do it. When they start the treatment, we do a 3-month check where we're like, okay, so you've been scanning for a while. Is this something that you're interested? Do you want to stay on 4-week cycle? Do you want to go 1-week cycle? We don't change it anything majorly, so it's either 1 week or 4 week. But that's the checkpoint to make sure that they're happy with what they're doing, right? And some move up, some move down, right? And the way that I look at these virtual check with aligners is the engagement with the patient. It's less of, I don't want to turn their compliance to my problem, right? Aligner treatment come with a compliance. If you're ready, if you want to do it, then you got to subscribe to the idea that you have to take care of the compliance. If you're not doing it, then it's not my problem. I don't want to take over that. And we also, I believe that if you scan the patients, you have a better way to try to communicate with the patient and troubleshoot the issue that they have. And I really like the feature that Grin has where I can do a review on a scan where I will just grab and explain everything and send a video back to them. There's a lot of time that the patient get that, they're very excited about this feature, which is very easy to use it. And I really like that. So what about digital braces? So I mentioned to you that we are doing only digital, so IDB digital, or the wire that we have is generally custom appliances. The Schosmai wire, I have buccal and lingual, and I have some cases on Brias and KLON. So for these patients, we also do the same thing. 4 weeks check. If you want to do more, we can do more, but I really discourage that because I will talk about this a little bit. I want to not collect too much data because the more data I collect, then I have to deal with it, right? So I'm very careful about, why do I really want to do this? And that's just the engagement with the patient. And engagement with the patient, if I get a scan every 4 weeks, it's more than enough for me. And then, when something goes, when they're having a question or they want to ask, the 550 million question that the engineer around me, they have about everything, they just send me a scan and I look at it and then we connect. And they're generally people that they are very visual. So when you highlight it, when you explain it, your bond with that patient increases significantly, right? So that's, to me, that engagement with the patient is actually more important than me tracking my treatment, on Grin or any virtual appliances. Because the fixed appliances, the beauty of these custom fixed appliances is that compliance is kind of out of the door, which I love it. I mean, to me, if I have a patient that is going to pick a liner versus short smile wire, I'll take short smile wire every day, all day, because I know that if I put the wire in and tell them come back in 12 weeks, which generally what we do, I'll get 80% of what I put into the wire. With a liner, you're at the mercy of the patient actually wearing these things all the time. So, besides the treatment, what else you can do with any sort of a virtual check? So you can use it in the pre-treatment and post-treatment. And when you look at the pre-treatment, you have screening for orthodontic care, and I'll talk a little bit about that. Observation, and then for the post-treatment, you have between phase 1, phase 2, and the retainer check. So for the observation, for the consultation, I think we look at this a ton, and Grin has been really working, a few different plan on making this better and better. So this is a page that was set up under our account, so you can actually have that set up for you. You build it in your social media marketing that you have, where the patient will be pushed into this page. And if they're interested, they fill up their information, and then Grin will send them a scope, and then we do the virtual check. I play with this a few different ways, and this is my kind of overall take on this. I'm not really interested to send a Grin to a patient that on Facebook or whatever, on a whim at night, decided that I want to do orthodontic treatment, right? I want to make sure that when they wake up in the morning the next day, they're still interested in orthodontic treatment. So we don't really encourage them to go through the link, even that I'm still trying to figure out how to smooth this up. I know that Grin is sending these scopes so much faster than before. So I would say try it. And every market is different. So you got to just do some A/B testing to figure out. But what I like to do is that if I find a patient that, either book online, because all our appointment is online, you can just log into my practice website and pick up your appointment and book your initial consultation, right? If I get a consultation from a patient and I'm like, okay, you're living so much further out where I am, how about we just send you a scope and we do the initial screening. If you're a good candidate, then we'll bring you in. They get excited, right? And I feel like that's a good, unique proposition that you could have for your patient. Or if you're having a good relationship with your GP, you can leave a bunch of these scope with the GP and they just hand it to the patients for a referral, right? I mean, I see about 50% adult, and these are cases that I know nobody else touches it. So the GP will give it to them and they will go and scan. So I have a better understanding of what am I signing up for when the patient comes for the consult. And sometimes you actually see stuff that was like, let's take care of these items before you come in for the consult so we can make that consult even better experience for you. So those are the way that I use for the consultation. It's not directly going to the patient, but through other stuff that you can use. The other option that you have to use Grin is for the observation, right? So you want to reduce the visit to the office, but you also want to keep the connection to your patient. So I have this idea of 4+4, which is basically 4 months a Grin scan, 4 months coming to the clinic. I don't want to lose that connection with the family, so I don't want them to go too far out, but I can do a quick check in 4 months. So it's 8 months of observation, but we split it into two kind of time point. One is a virtual check, one is the actual in-person check. And the other thing is that, again, I live in an area where there are a lot of engineer parents that they want to know everything. They buy textbook and bring it to the clinic, like to that level. And I'll be their Google. I'm like, okay, if you have any question about your kid, just scan and send your question and I can answer it, right? And that helps me a lot to connect with the family that are on observation. So I use it for that purpose as well. Then in terms of the post-treatment, we have retainer check. I combine the Grin visit or virtual check with certain packages of retainer, right? So it's not for everybody. If you want to get one retainer and walk away, then perfect. But if you pick this specific retainer program that we have, then it comes with, me checking your teeth virtually or coming in person. So you got to combine that with the retainer package that exists, right? And then the phase 1 and phase 2, it's a really good idea to have the patient on that. And again, the same thing with observation is try to be in touch with the family, right? It's a little thing, you give it to them. They keep it, and then if they have any question, they ask you. They lose a tooth, they take a scan, send it to you, you look at it, you explain to the mom. It makes it way more easier, and it's better than 2D photos to try to explain things to the parents, right? And it could be done virtual, completely virtual, kind of like a non-live version. Because if I want to, let's say they send a photo to me, right? I look at it and I say that they lost their, lower canines, primary canines, and the adult canine are coming in. Either I need to get on a Zoom with these, or sometimes we use Google Meet. I need to get on the call, talk to the parents. Here goes 30 minutes of my day, right? But if I have these video, then I will just look at it and I'll re-record a kind of scan review, and then I send it back to the mom, and they look at it, and if they have a question, hopefully in 3 texts we're going to be done. And then there's 10% that they definitely want to talk to me, and then I would deal with that 10%, right? So it's the goal is to try to use the 3-dimensional view that you get from the patient's mouth and communicate that with the parents. So this is kind of like how I look at the whole virtual check through Grin platform. And then I'm going to talk to you a little bit how I manage the task associated to Grin. And I know that, Grin platform is working on developing some sort of an internal task management. It's going to come. I don't know the ETA, and you can ask all these very expert people on the call that they can tell you what it is, but I can tell you how I do it, right? So we are completely on Google Workspace. It used to be, this is the brand new name. I even forgot what it's called. Google Workspace is that has everything that you want to have from our email, for our calendar, Google Meet, and everything. And this task management was something that it's recently improved so much. It used to be very, very, basic. Now you have this task board. So if you go on tasksboard.com, it takes you through Google Workspace, and you have these kind of like the board that you can develop it. And this is how I build it. You can build it however you want to build it. And the idea is that, basically it's a pipeline that the patient move through it, right? And each patient will have a card, and you can see an example of a card on the right side of the screen. And you can see how you can assign it to different people. You can have a subtask as well. So I'm going to show you a video of it. I hope that the quality of this thing is better. Sometimes. Yeah. So if you look at the board in here, right? So when you log in, this is your board. You have everything in here. If I click on a patient, let's say Trevor in here, and edit it, I can write whatever description that I want for whatever that they need to do. For example, this kid is chewing through, and I created a kind of an example board without all our patient, just for the HIPAA privacy and all those things. So this is a kind of like a pseudonym for this patient that chew on the aligner. Literally, he make the aligner completely flat. So we had to talk to the mom and say that don't chew on the teeth on these aligners, right? So I write that down, just mark it as urgent. It's on clear aligners, assign it to a team member, and a team member has a specific time of the week that they need to check these things. We put a deadline for it, and boom, this is a card. If you want to create a subtask to enter that into the practice management, you say the document in the practice management. I'm not so happy about having multiple platforms to do all these work, but unfortunately, majority of the practice management in orthodontic world are so poor in having a clean interface or having these kind of features. So we ended up going through another platform, right? So you can also have it a little bit differently dialed down in here. And you can move the card through these columns that you have. So you basically easily just move it from one side to another side. That's how we manage the task, right? And there's one person that is managing it, right? And so why I use this is because if you go check the Google Workspace, if you sign the business associate agreement, the BAA, which is literally just a check mark, then the platform is completely HIPAA compliant, and you pay $5 a month per user. If you paid annually, if you paid monthly, it's like a 30 cents more or $1 more, right? It's a very not very small amount of money, at least for now. And I'm hoping that Grin builds something like this in the back end so I don't move out of that platform. But for now, this is a perfect solution for a reasonable fee and a very easy system to use it. And if you're already on Google platform for your Gmail and all the other stuff, then that is very, very easy to manage. So now I want to just kind of like summarize all the discussion and kind of like bring everything back and rethink through orthodontic virtual check, based on what I look at it in 2016, fast forward today, right? So when I look at this, to me, with all these crowded market, GPs doing Invisalign competition, there every corner there's an orthodontist, and for all of these, I think service industry and including orthodontics, including dentistry, is going toward patient experience, right? So what is very, very important to me is always going to be patient experience. What am I doing day to day? Am I introducing more work from my patient? Am I creating stuff that is going to backlash into the experience that the patient is going through when they get treatment through us? So here's an example, right? What I know from the research that I showed you is that not everybody wants to use virtual check. There's a dichotomy there. The percentage is going to vary based on where you live, right? This is an example of an engineer in the practice, which was on a virtual check, weekly scan. He was treated 6 months. From month 1, he was like, when am I going to be done? I was like, we just started, right? Very simple case, right? After 3, I use this concept of sprint that, it's a little bit out of the scope of this talk, but we did it almost 6 months of treatment. To me, this is a very good result. He's super happy about the result. The only beef that he has with the practice is that I'm not really sure why I was on this virtual check, and he's complaining about it because I had to log in and explain to him what was going on, right? So to me, I think I overdid it. I collected more information from him. The AI in the system was giving him some sort of a feedback that he didn't like it. He's very literal about everything. So he would take everything that he would get and kind of turn it into a huge, huge problem for me. So, after going through a few of these things, I decided to go through a simpler platform that I have a good control and then revisit all my approach through virtual check, right? So this is an example of what I mean by patient experience. And that could vary very differently from each practice to another one. So that's what you want to think about. The other thing that I really want to be very careful about it, because I feel like we're going through that kind of like the phase in orthodontics that maybe the tech went through it back before. We're overloading ourselves with a lot of information. The question is that, why do I need to scan per week? And is it important for every single patient? And the other thing is that, what do I need to do minimal? Like, if I figure out what is the least amount that I can get a scan from this patient, that I can help them to navigate their treatment, yet it doesn't become my problem, that's where I want to be, right? And if you look at, how the peoples are dealing with a lot of information that comes through, they try to change the behavior, right? So we are going to have all these platforms. We have text messaging, we have, virtual check, all those things. I think we got to be careful to not, just the fact that there is something available, we don't just get overexcited about it and jump on it and create more data for us to deal with. So that's very important to me. And then, the elephant in the room is always the cost, right? How much these things will cost? How do I, want to use these? But I want to be careful, right? Because, the inflation is here, the staffs, they need more cost, the rent is higher, and then the growth of the cost of per treatment is not changing so much, right? So if you look at this data that Chris Benson presented, his projection is that we're going to go from 15% orthodontic supplies and lab fee to about 20%, fast forward in a few years, right? In 2030, right? So when you think about it, the orthodontic supplies, all of these treatment, you have appliances that we talk about it. If you move to custom appliances, they're going to cost a little bit more. And then if you add the virtual check cost, you got to be careful. What I like to use, I like the idea of a subscription or a fixed monthly cost so I can plan my year according to that, right? So that's very important for me when I look at this, any platform that has a virtual check. then that's a model that to me it makes a lot of sense. And then you got to also think about the digital task coordinator salary. I mean, the good thing is that you can get, very sharp, bright people, young people that they don't maybe need a ton of orthodontic skills, that they can run all of these, tasks for you. So I put my brain into the custom appliances. I show them that this is what is going to happen, and then they grab it and use it. So that way I can basically move the cost from the staff bucket to the orthodontic supplies, but I got to be careful to not overload the orthodontic supplies with the cost. So just to wrap up everything, when I look at what is the ideal, environment for me, if I want to pick a super app, right? And that's kind of a term that you probably heard it. It's so 2022. I want to have an application. Here you go. Another app popping up. I want to have an application that collect the data for me. I want to have an app that collect the data for me. Either it's photo, it's video, whatever it is, right? And I can look at those data and make decision for the treatment for my patient, right? And I also want to have some sort of an app where I can communicate with my patient back and forth. One of them would be the text. One of them would be audio. And I also like them to schedule to some degree on my day-to-day schedule. There's a special asterisk next to that schedule because I've tried it so many different ways. I want to have a control. Maybe the better way is to say control the scheduling, right? So the patient can go into the system and schedule what they want to do. So this is kind of like the summary of at least how I look at Grin, how I use it day to day. And, I'm looking forward to more practices using these systems, and then we can share ideas and try to make it better. And thank you so much. I'm going to pass the mic to Zach.
Yeah, awesome. Thanks so much, Dr. Khosravi. I really appreciate you taking the time to kind of hop on tonight and give us all some insight into how you're using Grin in your practices. A big thank you to everybody that took the time out of your busy evenings to join us here tonight. Real quick, I just want to let you guys know to please be on the lookout for an email that's going to be coming from us shortly after this call. It's going to include a link that you can use to directly contact the Grin team to learn a little bit more and have a little bit of more of a deep dive into the platform. If you have any immediate questions that don't get answered in the Q&A here, please feel free to reach out to me directly. You see my email there in the bottom right-hand corner of the screen. And for any current users, obviously, please feel free to reach out to your customer success manager as well. But yeah, thanks so much again, everybody. We really look forward to continuing this conversation with you all very soon.
Thank you, Zach.
Of course.
I think if there's any question, I can answer it.
Everybody feel free to come off mute. Now we're going to enter into the live Q&A with Dr. Rooz. Dr. Rooz, I just want to say on behalf of Grin, thank you so much. That was a great presentation.
Absolutely. Yeah, my pleasure.
Great job from Dr. Depew. Hey, Dr. Depew.
Doing.
Bruce, I have a question. Are you finding that your value per visit has increased since you began using either form of remote monitoring, or has it not made that difference in that category?
I like that question. No, that's like on par with everything that I do. Like, to me, when people ask me about the benchmark, there's one benchmark to me and the value per visit. I think it increased, but there's so many factors that goes in that I can't dissect it and say that it's virtual, right? So I do aligners, I do custom appliances, I push the patient out because I build the treatment and use these virtual check to kind of make sure that the ship is going the direction that I want, right? So the short answer is yes. How much, how, I don't know that. It's extremely hard to tease that out, right? I think it's a practice modality that you build that requires a virtual check, software sitting on top of everything. You need custom appliances, whatever it is. And then you need, the kind of like patient that understand to go through it. So I wish that I had a better answer to that, but the short answer is yes, but I don't know if it's actually the virtual or is a it's the other stuff that is going to do.
Great. Thank you.
Absolutely.
Hey, Rooz, it's Colby. How are you?
Hey, Kobe, how are you doing?
Yeah, great job. Hey, I was going to ask you, I know you do a lot of, custom appliances. You do a lot of hybrid treatment, a lot of lingual treatment, aligners, pretty much all of it. Do you notice a correlation between like someone's willingness to use Grin and what type of treatment they're picking in your office?
The thing is that, so I sell what I want the patients to buy, right? Let's just put it that way, right? I think if I believe that the virtual check is going to help the patient to get to the end of the treatment with the appliance that I have, I will convince the patient to use it, right? And I showed you an example that it failed, right? So, and that was like maybe too much of data collection, too much of automation, right? So I think that if you pick a hybrid appliances and put them on Grin, I mean, I can go through some example, like, a partial fixed wire in here that I put in here, and I have on the lower left side, there's a patient that I'm trying to picture it. The aligner cannot grab the lower 5 that is tipped in so much. So we switch to the fixed appliances, right? And I can just monitor that. And when the time comes and that tooth is upright, because I don't need to work on anything else, then I bring her in, remove the partial appliances, the partial segmental fix, and put her on aligners, right? So I don't know if there is a clear correlation. It's more like, again, I sell things as a package, as a service. I don't want to be associated with a product when I talk to the patient, right? The product is something that helps me to do the best that I can. And I firmly believe hybrid appliances are so much more efficient than pure aligners. Did I answer your question, Kobe?
No, that's great, Rooz. Yeah, well, I like the idea of thinking about how if you're starting from day one with a plan, just like we give a patient a treatment plan, whatever it is, your treatment plan includes virtual check-ins, right?
Yeah, it's there.
Yeah.
We don't separate it, right?
Yeah, and that's huge, because if you bring it up later, right, it's kind of like, oh, are you don't want to see me, or I don't know, right? You always wonder how they're going to take it. So.
I the only time when I offer so virtual check is a part of the process, no matter when I want to put it into the system. I don't believe necessarily in charging the patient extra, because it's something that helps me. So why would the patient has to pay for it? If I can finish the treatment faster, then the value per visit is going to go high. So boom, that's my profit, right? So when the patient comes in, the only time that I add the virtual check to their operation in the middle of the treatment is generally like, okay, you're asking too many questions from me, and I want to answer all those questions, but I want to get better quality data. And here's the scope, just a scan. And when you walk out of the door, Chris, who is my scheduling coordinator, will add you to Grin. And just send me the scan whenever you want. We'll help you, right? It's kind of like one of those, again, is like differentiating factor, right? I don't want the patient to associate with me with not want to see them. I want to be actually in their pocket every day, all day. That's basically what a virtual platform will allow me to do it.
Awesome. Thanks, Rooz. Great job.
Absolutely. Any other burning questions?
Hey, this is Pam, not on the burning question side of things, but hey, to anyone on the webinar, this is Pam. I'm co-founder, COO here at Grin. So just what I love about your presentation, Rooz, is that obviously you say it as it is, right? You say the challenges as well as the benefits. And not only that, in addition to that, you were also it was very interesting as opposed to a lot of the doctors that we talk to and we have on the platform. One of the things that is interesting in this case is that you have a little bit of a different way to use the platform. It's very non-templatized. And I think one of the things that strikes me when I think about how we built the product is that it allows for these type of offshoots, if you will, of types of doctors who decide to use the platform in different ways and not necessarily take the out of the box templatized way to use it. So you gave some good examples. One of them was the remote consultation example, where you decided to just kind of run your own remote consultation program where they and we have a few other doctors who've started to use it the same way that you described, where a patient actually calls in, they schedule the remote consultation, or they schedule not the remote consultation, sorry, the in-person consultation, and then after the fact, your team goes back to them and offers a remote consultation and ships a scope. So that's an amazing example. You mentioned Chris, I think, that is on your team that then invites a patient. A kind of double clicking on that one a little bit, have you had a chance to use more members of the team to manage?
Yes. I mean, I think this was added fairly recently, and it was like the best day of my life. Like, now I know that, because it was before, it was like we would share the account, but now she has it. So both my TC and my scheduling coordinator are on the platform, and they take care of onboarding the patient. They take care of some of these, like when I'm out and doing other stuff and I don't have access to Grin, they actually respond to all those emergencies that they come through, because sometimes they ask questions, they all get notification on the email. So I love that. I think that's one of the really strong features that we have on the platform. And just kind of echo what you say, I completely agree with you, the fact that, to me, Grin is a simple platform, and I love the simplicity, because the easier it is, the easier I can implement it, or anybody else can implement it however they think that their practice is operating, because every practice is different, every environment is different, every patient is different. So you got to have some sort of a leeway to, you can move around and adjust your practice philosophy and whatever that you do to the platform.
Thank you very much.
Absolutely.